The World Health Organization has said Africa is experiencing a resurgence in COVID-19 infections as countries relax their restrictions. The number of new daily confirmed cases overall has started rising after slowing since mid-July, and the WHO says there's been a substantial rise in deaths over the past week. WHO Africa Regional Director Matshidiso Moeti says the continent is at a pivotal moment. We are now joined by WHO Regional Technical Officer, Dr. Mary Stephen. Dr. Stephen, it's always a pleasure to talk to you. Let's just first begin with the second surge. And I mean, surely this has been something that has been spoken about for quite some time now. Is Africa really at a serious risk here as a continent?
Thank you and good evening. Yes, Africa is at risk. The risk of resurgence on the continent is still high. So what we need to do is to make sure that we put in risk mitigation measures in place to reduce these risks, because we have seen what has happened in Europe, for instance, in America, with the reopening of the economy, reopening of international travel. They are beginning to see cases higher than what we have seen before. And it can happen even in Africa, but what we need to do is to make sure that those measures are in place for the international travelers, screening, following up or self-reporting of travelers, and then for people within a country, making sure that the general population is observing the preventive measures. The issue of hand washing, keeping our distance away, using of face masks, and making sure that we avoid unnecessary mass gathering is very, very important in helping us to mitigate the risks of a second resurgence.
And when you look at, just the situation around the continent, and you're talking about something that's very important, safety protocols that must be adhered to, do you think there's a certain, basically people are relaxing right now because, countries are beginning to ease lockdown regulations? Do you think people are taking these lightly now?
Yes, so there is some level of complacency among the general population. For the same reason, we are seeing that the outbreak is coming down. We are not seeing so many people dying from the outbreak, and the hospitals are beginning to reduce in terms of the number of admissions. So this false sense of safety is beginning to creep in, but we have to make sure that we keep our alert high as much as possible, so that we don't lower our guard in terms of implementation or compliance with the preventive measures as general population.
And when you look at, of course, September, this was the month where Africa was set to also going to be seeing an exponential increase in cases, and it does look like it has somewhat averted that. When you look at the data right now, what is it telling us about how the cases are spreading? At what rate is this virus spreading?
Okay, so now the general spread is not in all countries. We are beginning to see increase in some few countries on the continent, and so the rate at which it's spreading is still not so high. We have seen some about 8% kind of increase in the last 2 weeks, but this is not in all countries. And so we need to make sure that we are implementing all these preventive measures, as well as keeping up with the public health measures to avert or reverse the increase in some of these countries where we are seeing additional cases. And for those that are still stable, to make sure that they sustain these strategies.
And when you look at countries, which would you say are more at risk now?
So now, some of those countries, we have countries like Uganda, for instance, that managed to slow down the progression of the outbreak right from the beginning, but later on they started seeing some surge in number of cases. Countries like countries like Mozambique. So Ethiopia, for instance, has had some increase, but they have managed to stabilize it in the last 2 weeks. So what we need is to make sure that all countries remain very vigilant. We implement the public health measures in a sustainable way, and of course, all of us, the general population, doing our part to be compliant with the preventive measures.
And how important is it, in this phase again for countries to ensure that they keep the correct information? Because in the, the first surge of the virus, there were some concerns that incorrect data was also being stored and not the correct numbers were really reflecting and showing just exactly what we are dealing with in the continent and even in the rest of the world, saying that some cases are not being captured correctly, be it deaths or be it, infections. How important is this going to be going forward?
Yeah, so it is important to keep our statistics up to date, making sure that the surveillance system is working properly. We have a system, fortunately, in Africa that we have been implementing for the past 20 years. And this we can scale up, especially in those lower levels of the health system, to capture both cases as well as deaths, including community deaths, so that we can report whatever COVID-related cases we have. So it is important to make sure that as much as possible we have the complete information, as well as information on contact tracing as well, because this is what you use to guide whatever decision you need to make in terms of implementation of the public health actions.
And how can countries improve on their surveillance system, particularly countries that have a high density when it comes to population?
Yeah, so now, in this case, what we need is community surveillance. So making sure that you engage, there is something we call community volunteers or community health workers. You can use them at that level. Basically what they do to make sure that they have access to the general population. They go basically house to house, engaging them, encouraging them to report any abnormal trends or any potential case of COVID or any unknown deaths in the community. And this can help the public health expert to go into such a community and do proper epidemiological investigation.
And this has been really tricky for governments to do, especially when it comes to balancing the livelihoods and ensuring that people are not dying from this particular disease. Should countries be reopening their economy, or should they also just be looking at tightening some of the lockdown regulations?
So this is a tricky question. So now countries in Africa, not just Africa, globally, they find themselves in a situation where they had to balance the public health measures with these issues of the economy and maintaining the livelihood. This is because both the economy livelihood is important as well as the public health measures. So it's a delicate balance. So striking that balance is quite delicate. But what we should make sure we are doing is that for the public health aspect, we continue to ramp up or sustain this capacity for surveillance, testing, contact tracing, treatment, and follow-up of international travelers, for instance, as well as implementation of preventive measures. For the economy, as we reopen, we continue to follow up and look at the trends and see where there are threats so that we can quickly readjust and ensure that the general population is complying with the preventive measures, because this is one aspect that is very, very important. The virus spreads when people interact. So we make sure that we are putting in those measures in place to reduce the spread of the virus, because we need both. We need the economy to work, we need people to have their livelihood, as well as reduce mortality from public health. So it's definitely a delicate balance and definitely not an easy decision.
And when you look at some of the predictions and even the modeling, and also speaking to some of the epidemiologists about just how things could be looking into the future, going into the second phase of the surge, how bad could we see a situation become if complacency continues?
Yes, so we can see an example of what is happening in Europe, for instance, in the United States. So if we become complacent, we could be at the same rate. But we have an advantage here, an opportunity in Africa to mitigate and prevent this from happening. And this has to be done by the government as well as the general population. So everyone has a role to play. If the government will open the economy, we have a responsibility as members of the general population to comply with these preventive measures, because this is for the good of all. So we need to come together, both government, general population, to make sure that we avert or prevent the risk of a second resurgence. We have seen what has happened in Africa. The predictions didn't come to pass for the simple reason that Africa took actions very early. The fact that Africa has had previous experience with responding to outbreaks. And the implementation of those restrictions, the closure of the borders and the lockdowns and all that, it helped Africa to avert the predictions we had earlier. So now we can use the same thing. So we know the things that are working, even though there is no specific treatment yet, no vaccine, but we know the measures that work. So let's continue to implement them in a very sustainable way.
All right. Thank you so much for your time tonight. It's always a great pleasure to talk to you, Dr. Stephen, as you put us in the picture about how exactly things are going to be moving going forward. That's the WHO's Regional Technical Officer, Dr. Mary Stephen.